Alright, so the findings of this next study might make you a little bit mad. Did you know that in France, the rates of schmopioid overdose are 32 times lower per capita than they are in the US? And in a fact that I'm sure is totally unrelated, did you know that 87% of people in France with a schmopioid use disorder get medication assisted treatment with methadone or buprenorphine? In the US, that number is less than 20%. Before we get into it, I'm Emma. I'm a science and medical journalist, and I'm working on a book about methadone. If you want to know more about medication assisted treatment for addiction recovery, make sure to smash the buttons. Anyway, this is Honora Englander. She is a doctor in Oregon, and she's been teaming up with scientists in France to try to replicate their success here in the US. In her latest study, published in March 2025, she interviewed healthcare providers in France about their attitudes toward medication assisted treatment. These people worked at specialty centers for addiction as well as general hospitals and facilities. And the findings really shouldn't be that groundbreaking, but they kind of are. They emphasize patient engagement as the first step and being most important. And in order to get buy in from patients, you should not be emphasizing an abstinence only model. They also pointed out that using punishment to try to control patients with opioid use disorders was not helpful to those patients. Now, I think most of this should go without saying, but I'm glad that we now have it on the academic record.